here. And to kick us off today, we've got a group and Al Lewis, our CEO, who most of you know. Al is the founder of Quizzify. He's our CEO. Al has written books about wellness outcomes and in detail a book with Tom Emmerich, who managed benefits at Walmart, and that talked about innovations in healthcare that Walmart, and they were writing about all sorts of innovations that are now happening back in 2013. And this is very much an innovation, and Quizify is very happy to be part of it. So without further ado, here's Al Lewis to tell you about a little bit more about an overview and our agenda.
Thank you very much, Mark. Here is the overview and the agenda. We have partnered with a group called ful CashPay to provide a part of a robust and affordable benefit for uninsured workers. It's unique in the market and is much needed. Trey will give us the description of this of the product in detail. And Quizify is partnered with them, and we're part of the solution. And you'll hear some from me. And those of you who are familiar with Quizify might recognize some of the examples we give. And then we're going to turn it over to Goodbill, which also has a unique solution, which they have figured out the Rosetta Stone for getting people in income brackets below $124,000 for a family a better deal on hospital than they can get right now. And with that, I'll turn it right over to Trey. Trey?
Hey, thank you so much, Al. I appreciate it and appreciate everybody joining today. We're so excited to have everyone here. And the reason why is because as you look at the marketplace as a whole, there are a lot of folks, and this is coming from a guy that's been in this space, in the healthcare benefit space for 25 years. There is such a need in the marketplace for individuals that traditionally are kind of forgotten. They're uninsured or they're underinsured, and we've not been able to solve that problem. But then you also balance the game of where is the value to the price for the solution that is in the market. And I will go ahead and tell you directly from the beginning, we have this price for the ful CashPay right at about $10 per employee per month. And I'm going to dive into what that really means a little bit later. But this is truly an app that, in my mind, is going to solve a lot of problems for a lot of people. So first, let's start with painting the marketplace. And I think most people know there are a lot of people in the hospitality and manufacturing and a variety of other industries such as that, agricultural, that really don't have access to healthcare benefits, even down to the MEC level. That's too expensive for them. And there also were employers who candidly, because of the size of their business and the type of business that they have, don't feel that they have a solution either to take care of those employees who are so vital to their organization. These are some stats that you can find in organizations such as SHRM or anywhere else, but there really are about 34 million people that we're talking about in this total addressable market. It's very, very large, and it is the backbone of America's workforce in many particular industries. With that, according to Alice, which is, kind of known as one of the leading organizations that are sitting there talking about underserved populations, about 42% are really today living paycheck to paycheck. When it comes to medical expense, and I'm honored to have Leslie on the phone as well as you, Al. Y'all are such an integral part about this. There are so many people that just need something because a medical expense of $500 can be detrimental to their future. There is 25% uninsured, 25% of the marketplace is valued as underinsured. And we at ful have really taken this marketplace and said, hey, for the gig workers, for the individuals that are part-time that really don't qualify because they only work 30 hours per week, what are those individuals' options? Is it picking up the phone and saying, oh my goodness, I need to go to the emergency room? Well, those of us in healthcare benefits honestly know that that's not the answer because it's going to come along with a $5,000 price tag in so many instances. So we know that there are people that are looking for solutions such as this. And we're honored to be able to be on this webinar today to kind of talk about the option that we've created and really talk about some of the partners that have joined us in this and create the successes that we have. We're tired of it being broken, and Ful's mission is to help fix that which is broken. So go ahead to the next. So let's talk about the market opportunity. You know, 78% of part-time workers really are seeking and are looking for an option for healthcare. They would stay with these employers that they're with, again, the backbone of these employers, that if they had a viable option. You know, it's expensive to replace these employees when they leave. The average stat that's actually thrown out there, and it's on the screen, is about $1,500, and that's on the low end. There are technology jobs and other things that it costs $7,500 in headhunter fees or posting ads or all of those kind of things to bring in an hourly worker to facilitate the needs of a business. What's interesting about that is we all know that there's a need, but there also is a massive turnover percentage. So many people are sitting there today, and estimates according to some of the human resource data that we pulled is that there's about 75% turnover for those type of positions in the marketplace. And when you talk about a business as 500, employees, which many of the hotel systems and things like that really are 500 employees, it's about 560 grand that you are looking at just in replacing the employees, not even including the salaries and things like that and the time that it takes to get that employee up to speed. We created ful CashPay to solve all of these issues. Our goal was to have a really easy to navigate, yet very affordable, as I mentioned, right at $10 per employee per month. And when I say that, I want to be very clear because I say per employee. The truth is our product, and go back for a second.
Sorry. That
No
was,
problem at all.
oops. What I don't know what
It
just
is all
happened.
good. I know this. I live this every
There
single
you
day.
go.
Not a
Okay.
problem. Our product is actually designed to be something that anybody can use and anyone can navigate. You don't have to have a PhD in healthcare economics to understand how to go find a valuable provider. We're effortlessly allowing you to navigate through a single app where you find providers that you're looking for, how you can get into different telemedicine type options that are immediate and real time, how you save money either on your prescription drugs or on your health expenses. And you can really do it from your fingertips, accessing the care. So those that need it the most are finally being given an option and a solution that allows them to do this without having to pick up the phone and call 55 different organizations to figure out who's accepting cash pay people and who's not accepting cash pay people. So our goal at Ful was to make that easy. This really is a first of its kind. Again, is somebody that's been in this space for about 25 years. I have looked and I have not found anyone that's created this. And I really am honored to participate and assist in leading organizations to finding Ful. What we encompass within this single app that I've talked about is a physician first virtual care network. And I mentioned earlier, this is for the entire family. This is not just for the employee. So if my son or daughter gets sick, I actually have the ability of using this exact same app and figuring out why my daughter has these little bumps on her throat. Well, guess what? It's probably strep throat. One of the problems that many people find, though, when they come to virtual care is that they have to wait for 15 minutes and they have to take this time to find the right physician and the specialties and all of this kind of thing. With Ful Health, we took that out of this. You push a button, and within 60 seconds, you are on the phone with a physician that can assist you. And this is not just the basic strep throat or cold. It goes all the way into behavioral health. It goes all the way into anything else that you can really think about, because those specialty of doctors, because we partner with one of the largest organizations in the country who actually facilitates some massive organizational contracts. They actually have set up a team of doctors that are available at any time, 24/7 on call, and it's zero cost to the person calling in and to the member. It's all included in the $10 per month that we mentioned. We also have cash pricing. And a lot of people, cash pricing is fairly new to many people today. But when you're unemployed, underinsured, all of the gig workers, all of those kind of populations, cash pay often is the option they choose. They just go to the hospital or they go to their doctor and they say, "Hey, I don't have insurance. What do I pay?" Well, at full, our mission was we wanted to allow people to understand what they should be paying and even show them physicians that are actually accepting said payments. And they can literally, from their fingertips, and I'll show you the app in just a second, but they can go out there and find a physician close to them where they can go and select that physician, put in what's going on, and we give them a bundled price. And it works in many of the major metro geographies. But that really is the goal, to assist these individuals with actionable cash pricing. Then we have hospital bill savings. And I don't want to steal Leslie's thunder. She actually has joined us, and I'm so thankful to partner with her and Good Bill in all of the things that they're leading in the marketplace. But they take 501R, which is the charity care element of many of the hospitals that are nonprofit in the country. They're required actually to have this. And it actually assists the member in receiving a discount all the way up to 100%, depending upon income limits. And she dives later into that, on what they can expect when they go in that hospital for that procedure. And they handhold you the entire way, because we know that the healthcare system is not necessarily easy to navigate. So they've taken that frustration out of it. And then finally, the other element that is really here, in addition to Quizzify, and we actually will talk about the educational content when I get into the app, but is how do I, as a person that is a gig worker, potentially also examine additional solutions, such as what can I do for ACA? Am I eligible for Medicaid? Am I eligible for Medicare? There's a lot of employees today that are working much later into life. So once they hit the 67 years old and they actually are eligible for Medicare, and those numbers can be 65 to 67, depending upon the age in which you came in, you have the ability of having someone who isn't trying to take the broker of record, who is simply trying to steer and walk you through the process of signing up for some of these valuable government programs that are designed to assist those that need in healthcare access the greatest. I will say this is non-insurance. This is a better and smarter way to save, obtain that access, and take control over the healthcare that so many people need today, rather than forgoing the services that they need. So people ask all the time, what is ful CashPay? ful CashPay is a single app. It's at your fingertips. We all have our phones in our hand at all time, and it's very simple to navigate. And as we're going through this, I want to kind of draw attention to a few of the partners, because again, many of these you may know, some of which you may not know, because they're emerging technologies that are kind of taking over the workforce in the marketplace. SiriusMD is the telemedicine provider in which I was mentioning. Again, 60 seconds access for the entire family to obtain all of these different levels of care in which you're talking about: acute, primary, behavioral health, men's health, women's health, dermatology. All of that is embedded within their ecosystem, and you have the access to obtain services. Then we have Quizzify, and I think that this is such a valuable element. And those of you that know Al and know Mark understand the amount of knowledge and the interesting perspective that they take with presenting information. You are going to teach the employees and gig workers, and even some employers, candidly, on things of how to navigate the healthcare system the best, how to follow those leads and trends where you're not getting overutilized healthcare or you're not being underutilizing the healthcare that you may need as well. And Al's got some amazing examples later on this. We also have a cash pay pharmacy option, including an embedded drug card in the system, which allows you to go to any of the local pharmacies. And I'm sure that it's any of the mass ones from what we've seen, as well as local and regional pharmacies, and obtain what that prescription cost, knowing that while there are some very large organizations across the country who are on many of our phones day in and day out, the savings here is greatly over what some of the mass market drug cards are available. We actually see about 40 to 60% in many of these situations, in almost all of the situations, but the goal here is to put the medicine and the service in the hands of the people as they stand. Then we have the cash pay. I mentioned that earlier. The cash pay is really designed to give you a bundle price so you know exactly what you're going to spend as you walk into that doctor's office. It actually gives you a bundle price so there's no surprises, and you have actually a sheet of paper that you hand to them and it says, here is the cost, or it's actually on your phone screen. So you know for a fact from a mission driven level exactly what you're looking for in a simple to understand way. And you don't have to navigate all the complexities that are out there of, do I call this anesthesiologist and do I do this or do I do that? It really is designed to make it easier for all users. Then you have the actual marketplace where you can go out there and actually shop. You can find services. You can understand what they're embedded in. And we use the partner Tendo here for this. Tendo is a great company that's kind of continuing to evolve and continuing to drive. And with the Tendo marketplace, you will find in many of the geographical areas a tremendous amount of savings as it stands. So there we go. I
The
mentioned
dog is around, puts his snout on the table.
it is all good, buddy. And then you have Benestream. I mentioned them earlier. They're the ones that help you navigate the government program space. And then you have Goodbill, which again, Leslie was fortunate. We're fortunate enough to have Leslie, and they're doing so much amazing things. But I don't. It is embedded into our app. You click a button, and everybody is available to assist. So that is really the overview of full cash pay. We are continuously excited about what is happening with this and how many people we can help in this completely underserved marketplace. So, Al, I'll turn it back over to you, sir. And again, thank you for the time, and I'll be available to ask any questions or is needed.
Okay, well, that was a very nice start to this, and we'll try to pick it up and keep people's enthusiasm level up. We add four things to the full quiver, four arrows to the full quiver. Excuse me. The first is when you go to the doctor, especially if you're, uninsured, underinsured, you're not going to have a lot of time. So you want to be able to spend that time well. And we'll start with that, and then we'll get into a few of these other things. For these doctor visits, we have what's known as doctor visit prep kits. They can, for 201 categories of visits, which represents about 80 or 90% of everything that anybody would go to the doctor with, we have prepared a cheat sheet to make sure you get the best, they get the best use of that time. So there's some, and this is an example from low back pain, but we have it, like I say, for everything. We give you a little bit of background. We tell you how to prepare for your visit, what questions to ask, what the doctor might ask you, what tests or procedures the doctor might recommend, and we give you a little bit of flavor for whether you really need them or not. And then the drugs, in the case of low back pain, they shouldn't be giving you any drugs, but the drugs that might be recommended, and then we link to the reviews for those drugs. So we have essentially the entire thing is laid out. Plus, we have links to sources, and occasionally we actually feature quizzes. For instance, low back pain has its own quiz. So you can learn, a spoiler alert, the answer for low back pain is not to do anything for the most part. You can also put this into your calendar so that when you go, it all pops up right there. I mean, it's on your phone as well, but this is belt and suspenders. Um, the other thing, and those of you who've been on our webinars before know that we have always been, the word obsessed is not too strong a word, obsessed with dental, because we've always said it's much more important to the employees than it is to the employer for the simple reason that the benefit is so skimpy. And just on Tuesday, we finally got some major objective confirmation of our instinct, which is that the Journal of the American Medical Association did a big study and they found out that in total, more money is spent on dental than on heart attacks across the US. The difference is that employers tend not to notice it because, as we say, the benefit is so skimpy. So this brings us to our first uh, polling question or trivia question. And what we're going to do is we're going to ask you the question, and then while you're looking at the answer, Mark, if any questions have come in from the audience, we can address those. So the first question is, what should you do about most small cavities? Your first choice is brush them away with fluoride toothpaste before they get worse, get them filled before they get worse, or tell your dentist to fix them without needles or drilling. And Mark, do we have any questions on the
Yeah,
first part of
this
this?
is a question directed more to Trey. Is the $10 per employee per month based on eligible, i.e. part-time employees, or the entire population? And does the $10 a month cover my whole family?
Yeah, so it completely covers the whole family, and I think that that really is something that's out there. So the employer pays at a PEPM basis. They send a census over to us so that we have all of the family units that are involved, and that ensures that all of those individuals are actually covered. So you're going to pay at the employee level, but it's going to actually benefit the entire family as long as we have them on the census that is signed for. Activation.
And Mark, do we have just generally speaking, which who won?
Well, we got a pretty sharp crowd here, Al.
Yeah.
85% got the right answer.
Okay, that simply means that 85% of people have been watching our webinars.
Yes.
Because yes, the answer is that, and we use this question a fair amount, but it's especially relevant to this crowd. Um,
Al, I think we lost your audio for a second there.
just by way of background for the other 15%, is most cavity. Could you have it back now?
Yes.
Hello?
Yeah, we
Is it
can hear
back?
you now.
Okay.
Yeah, I think you might want to start from the beginning
All right. So
about this explanation.
yeah, so those silver diamine fluoride fixes most cavities better than fillings. It's very simple to apply. As you can see down in the lower right, the dentist simply puts a drop of this stuff on what's known as a microbrush. You put it on the cavity, it kills the bacteria and suffocates them so the bacteria can't grow. And it apparently remineralizes the tooth in some cases. So it's that simple. And it's the only dental treatment to receive breakthrough therapy designation from the FDA. Pediatric dentists are required to discuss it with parents. Of course, they never do. Those of you who have kids know that doesn't happen, but it's supposed to. And there's zero evidence against this. This isn't controversial, except when it comes to the dentist not making any money. It does stain the decay. It will turn the decay black. Um, but you have to ask because dentists don't want to lose the income. I mean, these things there's 120 million cavities filled a year. That's a lot of money for dentists. I have it now twice. This is my own EOB. You can see $39 was the total allowed amount. Now, my wife's antediluvian employer, I won't mention any names, but it's up here if anybody wants to see it, does not cover this particular code, which is D1354. So they didn't pay anything. They would have paid half of the filling. So they would have paid 90 bucks. I would have paid 90 bucks. I saved them 90 bucks, never got a thank you note. So filling cavities is the biggest clinical boondoggle in the US. And the reason it's on this webinar is that it hits cash pay patients the hardest. And by the way, your part-time employees will love you for this, not just for the money, but we'll send you this link of a kid who's like Mikey. You know, he didn't want to go to the dentist, and the dentist does this, and he's very happy with it. Now, I mentioned that dental is more expensive than heart attacks. So just to wrap up, uh, there are employees, if they don't have medical, they don't have dental, period. Even if they do have medical, they may not have dental. Putting off dental care is a terrible idea. Many things, many medical things get better on their own. In fact, almost every medical thing I've ever had has gotten better on its own, or would have gotten better on its own anyway if I hadn't gone in and gotten it treated. Not so with dental. Almost nothing in dental gets better on its own, just gets worse. The two things that people hate most in all of healthcare are needles and bills, and that's what dentists specialize in. Filling cavities, I mentioned, is the number one clinical procedure in the US by far. And it's also the number one most inappropriate clinical procedure in the US by far. So you should absolutely be doing this. And Quizzify has two quizzes on dental. One is specifically devoted to silver diamine fluoride. So the next thing, and I think I know how people are going to do on this one because, like I say, I think it's we got our usual suspects on this webinar, is avoiding overtreatment, overdiagnosis. So the question here is, how does the radiation in a CAT scan compare to the radiation in an X-ray? And Mark, you want to put up the yeah. And while you're doing that, I can see we've got questions lined up here. Mark, what's next on the questions?
Um, Now, how are you defining underinsured versus uninsured?
Trey, I'll leave that to you. I mean, it's I have an opinion, but this is your specialty.
Yeah, so when I think of underinsured, I think those that just genuinely cannot afford healthcare. I think those that may be on MEC plans. I think those that are potentially on some of these limited benefit plans that are out there. And what you'll find is those individuals have so much money to pay out of pocket, or they get paid such a small percentage when they actually have a service done that they can go into financial difficulties because of that. So what you'll do is through the search tool and through using virtual care, rather than going to the emergency room and getting that $5,000 bill where the physician will, spread over 24 payments over the next 3 year, 2 years, you actually can, talk with a telemedicine doctor and have the ability to connect with them immediately and forgo that emergency room. The goal here is to really create the mindset and the education that the emergency room and specialty providers is not the answer for every single medical need that is there. There are obviously cases that you need to immediately go to the emergency room, and we all know what those are. But there are a lot of instances where somebody could forgo a medical emergency room visit just simply by talking to somebody that is very knowledgeable and very understanding about medical conditions. And I mean, it's been so when we talk about the underinsured, we're talking about the individuals that are forgoing benefit, going to the doctor because they know that if they do so, it's going to put some type of financial strain on their family. And as
Okay.
Leslie will dive into a little bit later, it actually is a pretty amazing number what people being classified as underinsured in the income limits are for those individuals.
Okay. Well, thank you for that. And Mark, what do we have here?
We continue to have a pretty sharp crowd. About 75% got it the right answer.
Yes, the right answer is that these things are full of radiation. Americans do vastly more than any other country. And the Journal of the American Medical Association says that we're addicted to them. Even though we do a zillion of these, our outcomes are worse than most of these other countries. So just because of the time constraint here, because it's taking a little bit longer, I'm not actually going to ask this question. I'm just going to, Mark, we'll just skip this one just because we want to make sure to get to Leslie here. The number one indication for spinal fusions is that the first infusion, the first fusion did not work. There are some people who think the entire spinal fusion industry is a hoax. These things are actually getting more common because they're being done outpatient, and the doc's saying, "Oh yeah, you'll be back on your feet. You'll be, free of pain in a few days." You will be most of the time, but go out 5 years, 10 years, the pain's going to be back and it's going to be worse. and the second fusion is not going to be successful as the first. Here's what you need to know about back pain. What Quizify teaches is that 80% of back pain goes away on its own, but 80% of people with back pain are convinced they're in the other 20%. So one of the things, if you are facing medical bills for things yourself, is in the case of backs, not to do anything most of the time, and most of the time you'll be rewarded for that. People in the US are harmed by too much medical care as well as too little. This particular population endures both. And we teach people that just because it's healthcare doesn't mean it's good for you. Now, the other thing we do is ER bills. We have found a loophole. It's not a loophole. We've figured out how to use federal law to keep the ER bills below $1,000. We have to teach employees how to do this. But when you get this consent, when you go to the ER, you're supposed to sign in two places. You have to sign to be treated, assuming you're conscious, but you do not have to sign the financial consent. There's very specifically two different places to sign. You can ask them to print it out, and then there's in green here, there's what you write in instead. And you write that in, and the ER is obligated to treat you exactly the same way as they would have, but for a much lower price. And when we sell this separately, we guarantee that every ER bill will be under $1,000, assuming there's no scans or procedures. We also have stickers available. You can put the sticker right on the consent after it's printed out. You don't have to worry about printing it out. What kind of results do you get? Well, here's a result from a facility, which is that they always upcode these things. So this is a 99285, which is the highest code, and we deal with the upcoding as does Good Bill. But even with the upcoding, the 2 times Medicare was still well under $1,000. They got a cash pay discount, so it went down to 478. You can see the consent over here. And that's facility, but we also do this for ancillaries. This was somebody who broke their foot. The crutches were billed at $15.80. The x-ray was billed at $46 and change. We suspect they forgot to multiply these by 2, but guess what? They could have multiplied them by 10, and it'd still be less than you would have been charged commercially. So those are examples of the ER. Now, what we try to do is we try to keep these bills down in the first place, but then you reduce it further for you. And with that, I'll turn it over to Leslie.
Great. Thanks, Al. Thanks, Trey. Great. So I think a lot of what Trey and Al talked about up until now is how do we keep members healthy? How do we keep them out of the hospital? But we all know that when somebody does have an emergency, they need to go to the hospital. That's where there's a chance of a really high dollar bill and a lot of financial pain, right? So we know that medical bills are the leading cause of bankruptcy right now in the US, and actually hospital bills are the leading driver of that. So that's where Good Bill comes in. If a member needs to go to the hospital for an emergency, for a surgery, for childbirth, we are going to do everything in our power to reduce that bill for the member. And the way we do that is through 501(r) discounts. So Trey already alluded to this. I'm going to go into a little more detail, but these are federally required discounts at nonprofit hospitals that many people don't know about. And then the second component of what we do is we do bill reviews and negotiations. So we are going to review the bill for any coding errors, any medically unnecessary care, and then we are going to bat with the hospital on behalf of the member. And all of this is with the help of our member experience, our member support team. So every member gets assigned their own case manager who is walking them through the process end to end and getting them to resolution. Okay, so 501(r) discounts on the left. These are required at nonprofit hospitals, and that is 60% of hospitals in the US that are nonprofit. So it's actually the majority of hospitals. They are required by law to provide financial assistance based on a member's household size and income. And then right here, I go into a little bit about bill reviews. We have found at Good Bill that more than half of the bills that we review contain errors. That's way more than expected. So we're talking about duplicate charges. We're talking about up-leveling, unbundling, medically unnecessary care. These are the two things that we'll do together whenever a member comes in and goes to the hospital. With 501R, I'm going to go a little bit deeper. Generally, it's based on a member's household size and income, and a member can get anywhere between 25% to 100% off their bill. In general, on average, across all hospitals in the US in 2025, you're talking about a typical household of four earning under $80,000, they would qualify for 100% off their bill. That same household of four earning up to $128,000 would qualify for anywhere between 25 and 75% off their bill. Every hospital is a little different, but those are the average thresholds we're seeing for 2025. So a lot of people don't know about this. We've worked with a lot of members who will get that scary call from the hospital. They'll get a final notice. They'll even get sent to collections when in fact they did not owe any money at all. They could have qualified for 100% off their bill. What we've done is we have taken all 3,500 nonprofit hospitals, all their eligibility criteria and applications, and we've put that in our system. And that essentially allows us to instantly screen the member, just like you're seeing here, based on 2 questions. And if they're eligible, we then move them on to the application form, which we've digitized. And then once we submit the application, our team is following up every 3 to 4 days until we receive a resolution from the hospital. One of the really cool things about 501R is that once we get that application in, and if the member's approved, the clock on the aging of the bill freezes. That means that the hospital cannot send the patient to collections. They can't balance bill the patient. All of that is frozen. So 501R affords patient protections that are really, really valuable. And then for ful CashPay users in the app, they'll get access to our 501R hospital finder. So all they need to do is plug in their household size and income and their location. And then they'll see all the nearby hospitals where they would qualify for a discount. Some where they might qualify for a partial discount, some where they might qualify for 100% off. And so now what members are doing is they're getting informed and educated in advance before they even need to go to the hospital on what their affordable options are nearby. Okay, so what happens if a member didn't go to a 501R hospital, or let's say they earn too much to qualify? By the way, in general, we see about 40% of members qualify for 501R across all our bills. And sometimes that can be as high as 60 or 70%. So what about the remainder of the population? We still want to do bill review and negotiation for them. So what we do is we ask the member to connect their patient portal. We've already connected to the EHR backends. And so this is a very seamless process. They log into their MyChart. We pull down the visit notes. And then we have licensed coders and clinicians doing a line-by-line review of every charge on their bill. They're looking for very common errors, duplicate charges, things like up-leveling. So that ER visit level 4 that was up-leveled to an ER visit level 5. And then they're also looking for clinical mistakes. So that CAT scan that wasn't really medically necessary given the patient's condition. We then put all those findings together in a negotiation package, and then we are sending it to the hospital to negotiate on the member's behalf. And it's a case manager, again, who's assigned to that member from end to end, and they are then following up the hospital every 3 or 4 days until we get a resolution. In general, I will say our success rate for bill negotiations is 50%. So we win 1 in 2 negotiations. And when we do, we're saving the member 20 to 30% off their bill. So all of this leads to real savings, real life-changing impact for members And I wanted to share a story about one of our members, Teresa Pierce from North Carolina. She had suffered a stroke and then she could no longer work. She came to us with a $5,000 bill from the hospital. But at the same time, she told us she had previously gone to the hospital a few times and she wasn't able to pay those bills. And so she became so stressed that she stopped going to the mailbox. We helped her screen for 501R and then apply for it. And she qualified for 100% off her bill. And not only did the discount apply to that one bill, the $5,000 bill, it applied retroactively to her previous bills. And it applied to a surgery she had scheduled for the following month. So, and that's generally how 501R works. It's usually good for 1 year at the hospital. So, in total, one application for 501R wiped $40,000 in patient responsibility for her. So, I'm going to hand it back to Mark or Al, and thank you so much. I'll be here for any questions.
Okay, well, you basically what you see is what you get. Literally $10 a month in most cases if you're over a certain size level, and that includes the free virtual doctor visits, the finding of the cash prices, the health literacy education, and the ER consent, and especially the dental, and finding financial assistance for these hospital stays, and the bill negotiation, all for about $10 a month. You can follow up either with Mark directly or with Trey directly. Excuse me. And we do have time for one or two more questions, Mark, if any have come in.
Does the ER consent or good bill work for urgent care?
No. Well, I don't know about good bill. I'll let you answer separately, but the ER consent is based on the Emergency Medical Treatment and Active Labor Act of 1986, and that specifically applies to emergency rooms and emergency visits and emergency deliveries and emergency transfers. Does not apply to urgent care.
Same. It only applies to any hospital facilities. So if there is something that is affiliated with a hospital facility, then Good Bill would cover it.
So you do cover urgent care.
No, we only cover hospital facility bills.
Okay.
But
All right.
some of these hospital facilities are associated with, clinics and things like that.
Right.
As long as it's under the hospital system.
And Mark, anything else? We got time for one more.
Why wouldn't someone just take the doctor's advice on scans or back surgery?
Well, 50% of doctors are below average. And the other reason is that sometimes we often tell people that the 4 words that will tell you that something is not needed is the doctor will say just to be safe. That means it's not needed. And a lot of times they are thinking about defensive medicine. They are also, many of them don't know that, say, a CAT scan is full of radiation. They may not even know that the 80/20 rule on back surgery. They may not know that medical MRIs, the contrast media gets stuck in your brain, gets lodged in your brain, and can cause long-term issues for you. So there's a lot of things that they either don't know or not telling you or have an incentive not to tell you. Okie dokie. Well, we finished exactly on time. I want to thank Leslie and Trey for being here, and we'll follow up with a note. And if you'd like the slides or the recording, simply
Great. Okay. Thank you, everyone, and thanks for joining us today. Bye now.
ask us for it. And we'll also send you that little Mikey thing.
Thanks.
Thank
Bye.
you.
All right. Bye now.
Bye-bye.